Okay, so welcome everybody. Thank you so much for joining us this evening. For those who don't know me, I'm Jackie Gambrell. Very nice to see you all this evening. I'd like to start by acknowledging the traditional owners of the land and paying respects to elders past, present and emerging. And I'd like to welcome any Aboriginal or Torres Strait Islander people on the call this evening. Now, hopefully everyone is here for the right subject, which is sex and sexuality, and sort of the transition to adulthood for TSC individuals. So we thought we'd start off with a quick poll, just to see how everybody's feeling about this evening. And for some reason, Rob, my poll isn't coming up. Do you have that?
I've just launched that there, so that should just be popping up in front of you in just a second. So how do you feel about the topic? And it's multiple choice, so you can select different ones there. You might be feeling scared and nervous or embarrassed and totally fine, and that's okay. So select whichever ones they want. Again, just keen to get a sense from the collective group here, how are people feeling about the topic? And I can see we've got 8, 9 of you coming through. I'll share these back so you can get a sense from the rest of the group here, how people are collectively feeling. Just a couple more to come through here. So how do you feel about the topic? And there's a clear majority. In fact, let me share those results back. Clearly you can see a good chunk of you, 54% feeling pretty fine about the topic, 46 a little nervous, some scared, some a little naive. So a bit of a mix in there, and hoping that we can support you with tonight's content.
Thanks, Rob, and thank you everyone for participating in that poll. And I'm sure Liz is going to help us all understand this topic and remove any negative feelings or sort of feelings of anxiety that we have. So I'm going to now introduce Liz. Dr. Liz Thompson is a doctor working in adult rehabilitation medicine. She lives with her young family in Newcastle, but actually trained in Coffs Harbour and Tamworth, and then specialised in rehab in Sydney. Her special interest is in working with people with intellectual disabilities. Liz is going to help us understand how we can have frank and open discussions and reduce stigma on the subject of sex and sexuality. And there'll be 2 opportunities during Liz's presentation to go into small breakout groups and perhaps consider some of what she's talking about and how it might relate to you and your family. You can also obviously ask more general questions, and perhaps you want to privately message Rob with those questions as we go through, or at the end of the session when hopefully we'll have a bit of time to answer a couple of those. Now, the one thing I should say is that you know, Liz is fantastic, but we can't actually provide medical advice on this call, and it's not really suitable to ask questions specific to anyone's specific treatment or care. Those are best answered by your own clinicians. So please keep the questions to a more general nature. We also understand that this topic can be quite confronting for some people, so please make yourself comfortable in whatever way you can. So now I'm going to hand over and thank very much for joining us, Liz Thompson, our guest speaker for this evening. Thank you, Liz.
Hi all, my name is Liz Thompson and I'd like to start with an acknowledgement of country. I am on Awabakal land and I would like to acknowledge the traditional custodians of this land, the Aboriginal people, and pay respects to elders past, present and future, for they hold the memories and traditions of culture and country for all Australians. That poll was really exciting. I was the person that answered naive. So for all of those who answered totally fine, I'm more than happy to hand it over to you, because sexuality is an area that is so large, and tuberous sclerosis complex is also a very broad topic. And it's important to acknowledge that people with TSC are quite neurodiverse. So please don't take any offence if during some of my discussion tonight I reference intellectual disability and you are a person with TSC who doesn't have intellectual disability. I'm not trying to be offensive. There's some assumptions that come to this discussion, and I suppose I want to make sure that I'm not putting anyone on the back foot or being rude or abrasive. So please feel free to correct me, and I'll be looking at the chat box the whole time. Next slide, please. I am a rehab specialist working across paediatric and adult worlds. A rehab specialist is a doctor with extra training in the fields of disability and aims to improve a person's function and their interactions with the world. I have further training in brain injury, spinal cord injury, spina bifida and amputee rehab. And I've worked a little bit with the TSC group at Prince of Wales and Randwick Kids, with David Mowat allowing me to sit in on some of the clinics there, which was such an eye-opener, and I really enjoyed it. At the moment, I work a few jobs. I'm sitting on the NCAP Division Guardianship Tribunal as a judicial member, and that can deal with issues around consent and capacity, for which sexuality topics sometimes cross over. And I work with a team at Newcastle that covers the whole of the central coast of New South Wales and the Hunter New England regions. We are called the Specialised Intellectual Disability Health Team, which is quite a mouthful, SIDHT for short, and those are our contact details. If you're in our region and want to get in touch, please don't hesitate to. We service people who identify as having an intellectual disability and who have an unmet health need. So that means their usual GP and usual carers for health issues aren't able to meet their medical difficulty or psychiatric difficulty. There are 6 such teams across the state. It's a new initiative and some of the teams are still starting up. I can try and give as much information about the teams onto the rest of the TSA group. So Jackie and I have been quite closely in contact, and as the teams roll out, I'm more than happy to provide any details that come to hand. Unfortunately, many of today's resources discussed will be either New South Wales or Victoria specific, but I'm happy to do further homework, particularly for that person from Hobart. I'm not a voyeur, but I have noticed a dearth of clinicians who are comfortable discussing sex and sexuality with their patients. As an intellectual disability clinician, one of my main goals is to acknowledge the historically hidden sexuality and traumatic history of people with disability. Australia has laws to redress overt discrimination. However, social perceptions regarding disabilities have a huge influence on how we discuss and view sexuality for people with disability. And I know not everyone with TSC will identify as having a disability either, and I'm more than happy to chat further generally about sex for people who don't want to identify as having a disability. Some of the benefits of sexuality and relationship education include improved knowledge and self-esteem. Education strengthens the resources of the person themselves and has been widely recommended and recognised, rather, as a mechanism to reduce vulnerability to sexual abuse. Sexuality education has the potential to encourage positive sexuality, promote decision-making abilities, and empower the person to act on their decisions. Sexual expression is an important part of being human, and positive experiences can build self-esteem and a sense of identity. As a society, we often have a limited opportunity to learn about sexuality, relationships, and reproductive and sexual health. Many people also have limited opportunities for experiential learning through established relationships. It is often the case that people with disabilities have less education in this area, unfortunately, and also may have a reduced amount of accurate information than those around them. In recent decades, there's been an increased awareness of the need to recognise everyone as sexual beings. A child with additional needs has the same interest in and need for information about sex and relationships as other teenagers. Rates of sexual activity for young people with additional needs are the same as those for teenagers without. Making sure your child has developmentally appropriate sex education at home and school can be quite a daunting task. Next slide, please. So when it comes to talking about sex, there's a lot more to talk about than the act of sex itself and the biology of reproduction. Sexuality education encompasses everything from attraction and sexual feelings, personal values, relationships, decision-making, intimacy without having sex, negotiating consent, and how to say no to unwanted sex or sex continuing beyond what you've already agreed to. How to have safe sex, contraception, sexual health, and STDs often fall to doctors and nurses to explain, but should be something that most of us have common basic knowledge of and feel confident discussing. I'm sure a lot of you don't know if any of your friends have had STIs, or it might be brought up in a jokey fashion, but it's really important as a society that we start talking more about sexually transmitted illnesses and also just pleasurable sex and sexual encounters. Dealing with breakups can be particularly hard for teenagers, and this is a time of transition. Talking with your children about reproductive and sexual health may seem daunting or embarrassing, but remember, you were once too, and you were young once too, and given everyone's faces, a lot of you still seem very young. You probably had all the same questions when you were their age. You might find it easier to avoid the subject or assume they'll learn what they need to know from school. However, avoiding sexual topics with your children will not stop them from having sex or necessarily keep them safe. Parents have a lot to offer to their children's sexual development and well-being that cannot be taught through school. Starting from a young age, discussing factors that influence your child's sexual growth and development, such as, and this is probably the biggest protective factor, correct naming of body parts. Discussing with your child how having babies and sexual feelings occur can build a good foundation of trust and respect with your child around these topics. Short and frequent chats during your child's development can help keep the lines of communication open right through to their teenage years and can make discussing these topics seem less confronting. Discussing these topics will equip your child with the knowledge to make more informed decisions about their health and future. It may be difficult to start, but it will become easier each time, and it's all part of your children growing up into young, well-informed adults. If your children are already teenagers or in their early 20s, it's not too late. Or if you're a teenager yourself, welcome to the club and let's start chatting. If you keep the lines of communication open and let your child know that you're there to listen, they'll be more likely to come to you with questions and concerns rather than the internet. TSC and the teenage years. As I'm sure you're all aware, and you probably know far more about TSC than I, there can be some challenges with the teenage years. As we noted, it has a wide clinical spectrum, and it's, as I'm sure all of you know, an autosomal dominant multi-system disorder characterised by hamartomas in multiple organ systems. There's a wide clinical spectrum, and some patients have minimal neurological disability. Clinical conditions commonly associated with TSC may have a large impact on sexual development and specific concerns regarding expressions of sexuality, such as skin lesions like melanocytic macules or facial angiomyolipomas may be causing someone to feel that they may appear different to their peers and may be inhibited about feeling confident about their body. Learning difficulties may affect socially appropriate expressions of attraction or safety awareness or development of friendships. Some people with TSC have increasing seizure frequency during puberty, but not all do. Epilepsy and the vulnerability that may be experienced during a seizure, like urinating involuntarily, may be a concern. Some people, women particularly, have increasing seizures around the time of their periods. And it's not an oversight to say women particularly, because I'm trying to keep in mind that people who may identify as women aren't necessarily born biologically female. PMS and increasing testosterone levels can mean more risk-taking in young men, and cardiac rhabdomyomas are seen in the majority of young children with tuberous sclerosis, and most spontaneously regress with no clinical consequence. However, during puberty, they may enlarge or appear spontaneously. Up to 86% of TSC can result from de novo heterozygous mutations. Approximately 10 to 30% of TSC are due to mutations in the TSC1 gene. And people with TSC have a 50% chance of passing it on to their children. I'm not a geneticist or a genetic counsellor, and I'm sure many of you have had helpful experiences with genetic counsellors or geneticists. If they haven't been helpful, I apologise, but I'm sure you guys could lecture me on this, so I would rather not expose my naivety and lack of awareness regarding the genetics. but it may be something that your person with TSC might be worried about. And if so, your local genetic service could be contacted to discuss how planning for a family and thinking ahead can be something that they can discuss even at a very early and young age. And that may be something that they have unspoken or that they may be thinking about and may be inhibiting them from developing sexual relationships even at a very young age. Romantic relationships are a major developmental milestone. They come with all the other changes going on during adolescence, and they're linked to your child's growing interest in body image and looks, independence and privacy. Romantic relationships can bring lots of emotional ups and downs, sometimes for the whole family. The idea that your child might have these kind of feelings can sometimes be a bit confronting for parents, but these feelings are leading your child towards a deeper capacity to care, share and develop intimate relationships. I was mentioning to those present just before everyone was let in from the waiting room that I am probably quite unqualified to discuss this because I was a teenager who didn't have sex. And I'm sure some of us have had awkward teenage years, but when teenage relationships start, seems to follow a general pattern. There isn't a right age to start having relationships and everyone is different, but some averages are that from 9 to 11 years old, children might start to show more independence from their family and more interest in friends. From 10 to 14 years old, children might spend more time in mixed gender groups, which might eventually end up in a romantic relationship. And from 15 to 19 years on, romantic relationships can become central to social life. Friendships might become deeper and more stable. Many teenagers spend a lot of time thinking and talking about being in a relationship. In these years, teenage relationships might only last a few weeks or months. It's normal also for your child or your person to have no interest in romantic relationships until their late teens or ever. Some choose to focus on schoolwork, sport, or other interests. First crushes. My mum teased me mercilessly about my first crush and I never discussed one with her again. And it might be worth taking a leaf out of that book of what not to do. Before your child starts having relationships, they may have a crush. An identity crush is when they find someone they admire and want to be like. A romantic crush is about your child imagining another person as perfect or ideal, and this can tell you a lot about the things your child finds attractive in people. Romantic crushes tend not to last very long because ideas of perfection often break down as we get to know those people. But your child's intense feelings are real, so it's best to take crushes seriously and not make fun of them. Starting the conversation. Before talking to your children or before talking to your parents about sexuality, it's a good idea to prepare yourself by talking about the topic with someone you trust, like your partner or another adult friend, to decide what values and messages you wish to communicate. Do your own research on the topics and find out about your local health services so you can advise your child of confidential places they can go for information and support if necessary. Try to be approachable, unshockable, and available to listen. Don't lose your cool, be confidential and non-judgmental, and let your child know that you are happy to discuss these topics with them. If you're not, that's okay. Talk about how you feel. If you feel nervous or uncomfortable, acknowledge that fact and maybe even laugh about it with your child. Talking about your feelings can help break the ice. Be willing to answer questions openly and honestly. If relevant, share stories, although that might result in awkwardness, of when you were growing up or things you always wish you knew at their age. Provide the correct information. If you don't know the answer, admit that and let your child know you will find out and get back to them, or you could find out together. And have a sense of humour about it. Encourage questions, know your own values. Parents are in the unique position of being able to pass on information and personal family values to their children. Knowing what your values are and deciding how you can express them in a way that is encouraging and supporting rather than demanding is really important. Also, acknowledging that your child may have different views to your own, and whilst it may be hard to accept, it's important you acknowledge this and let them know that you support them and their decisions. Know your boundaries, stop when you're uncomfortable, and have someone in mind, like a family member or a trusted friend or youth worker, who you can suggest they talk to about those topics. Be aware of your non-verbal communication. So your child will notice your reactions, your lack of eye contact, or your mumbling if you're uncomfortable. And it's okay to acknowledge this and move on. Really listen to them. Discuss issues relating to both genders. Children need to learn about what happens to the opposite sex just as much as their own. Be technologically aware. Learn about the different technologies your child is using, what protection you can put in place, and the benefits and risks associated with them so you can keep your child safe online. Even if you're a teenager, you may want to put some locks on your own devices to make sure that you don't get attacked or cyberbullied or are vulnerable to people who shouldn't really be talking to you. Social media provides lots of opportunity for your children to stay connected and informed, but it's important they're aware of potential risks. For people, sorry, it looks like I've been muted by the host. There we go. Can you hear me all right? Great. It's important for people also to be aware around the laws of texting and sexting. So if someone were to take a photograph of themselves under the age of 16 and send that on to anyone else, that's producing and distributing child pornography. And the person themselves is at risk of being charged. Although that would be quite unusual, it is something to be aware of. Be positive. Remember to talk about the fun stuff and not just focus on the negative consequences of sex. I think our society's come a long way from thinking that sex resulted in unwanted pregnancies and that was the only way to view it. But your child deserves to know and be excited about the positive, pleasurable side of sexuality, including love and expressing sexual feelings and having rewarding relationships. One way of teaching is to use teachable moments to ease into a discussion rather than leaping immediately into the conversation. For example, if a TV show shows something relevant, you might bring it up, or you might ask about what they've learnt in their recent PDHPE class. You could ask your child your opinion of something you've heard, and then ask more questions from there. Try to have ongoing chats with your child, keeping them casual, frequent, and non-threatening, rather than intense one-off conversations. It may take a couple of conversations before you get the hang of it. The more you do it, the better you'll become. Breakout session.
So team, to everyone, community, what we are going to do is just have a quick conversation. In a moment, through the wonder of technology and Zoom, you're going to find yourself in a slightly more intimate setting with 3 or 4 of your fellow community members here, where we'd love you to just have a quick conversation and share a little bit about where are you or your child at in terms of this topic. It's only going to be short, so just 4 or 5 minutes there, but we're just going to send you off. Have the conversation and potentially looking forward to hearing any questions you might have when we come back. Again, the topic is in the chat for you there, team, and enjoy the opportunity to have a quick conversation.
So now to chat about some of the resources which are much more helpful than me. So Family Planning New South Wales is a great resource to start out with. Their website bodytalk.org.au is really good. There are sections on sexuality, relationships, consent, safe sex, contraception, and lots of resources for parents. There's also a body explorer where young people can select different features from a cartoon body and explore internal and external parts, which is quite interactive and pretty important to know what each of your parts is properly called and what it does. Other helpful Family Planning New South Wales services include their youth drop-in, where a doctor or nurse consults, and they happen regularly on Tuesdays and Wednesdays with bulk billing for people who hold a concession card and those under 18 years old. Those clinics are present in Ashfield, Newcastle, Penrith, Dubbo, Fairfield, And there's a number of female staffed outreach clinics in these locations: Blacktown, Coonabarabran, Campbelltown, Cobar, Miller, Surrey Hills and Tarmore. They also at Family Planning have a condom credit card. This is a friendly and confidential way for young people to access free condoms, lube and sexual health info. They get 12 free condoms every time their card is presented at a registered provider. And there's an app with a GPS-enabled map which displays all of the providers. This can be downloaded from the Apple App Store or Google Play. Family Planning New South Wales also offer Talkline, which is a free confidential helpline where you can speak to an experienced nurse about anything sexual and reproductive. Some of the All About Sex fact sheets might also be helpful, and they can go through items such as, or topics such as public versus private body parts and appropriate places for certain behaviours. The All About Sex fact sheets are provided mainly for people with intellectual disability, but there's some general information that can be quite helpful. Reach Out is the most accessed online mental health service for young people and their parents in Australia. It's a trusted self-help information, peer support program and referral tool that saves lives by helping young people be well and stay well. The information available at Reach Out Parents is evidence-based and underpinned by evaluation and research. It has been present online for more than 20 years and it's accessed by approximately 2 million people in Australia every year. There's a special parents discussion section and you'll also be able to find resources such as fact sheets, stories, practical tips and tools covering a range of topics and issues and experiences relevant to those aged 12 to 18. The Parent Forum, where you can talk to other parents about your experiences and work through your concerns in a safe, anonymous environment, is particularly helpful. They also have some really good sections on supporting teens with sexting, how to make self-care a family priority, and helping teenagers feel more confident. There's also a quiz on how to find your parenting superpower. The Raising Children Network has some really reliable and scientifically validated information resources that can help parents with day-to-day decisions of raising children and looking after their own needs. The Early Teenage Relationships section is quite useful, and it talks about if your child has a boyfriend or girlfriend, what their boundaries might be, what they might want to be doing with that person, and how they can have safe and comfortable conversations. It acknowledges in Raising Children Network that the most influential role models for teenagers are the grown-ups in their lives, and that you can be a positive role model for respectful relationships and friendships by treating your partner, friends and family with care and respect. And just talking about both men and women respectfully lets your child know you think everyone is important, equal and valuable. There's a little bit also on there about same-sex attraction and early sexual experimentation and ways to help you respond positively and non-judgmentally if this is the situation. And they can also offer some extra help with teenage relationships and suggest other resources like your GP, the school counsellor, your local community health centre. There's also Parent Line in each state, Family Planning Alliance Australia and Relationships Australia, which are nationwide. One thing we should probably acknowledge is that being safe for parents and teenagers is really important. So Kids Helpline has the teens section, which is free, confidential and 24-hour counselling available for young people. And calling that number is, the number is 1800 551 800. And they can also access counselling by email or online. Also of note, the 24-hour National Sexual Assault and Domestic Violence Counselling Helpline. The number for that is 1800-RESPECT. Other resources that I flicked to Jackie only today that shouldn't be missed out on, I hope she can share with you, include My Care Space, and it's got a great list of resources and suggestions from a person with a disability, and it covers pretty much everything, including sex toys. And then there was a really exciting decision by the Federal Court in May 2020, and it's yet to be challenged, so hopefully it will stay, that allows NDIS participants to be funded to see a sexual therapist. Now, I'm sure most of you know the NDIS covers reasonable and necessary supports, so to have sexuality acknowledged as something that's reasonable and necessary to live your life normally was very important for the disability world. So Touching Base is a service that has there's also an online order form available for social stories on seeing a sex worker, both in, unfortunately they're just in heterosexual relationship story format, but for males seeing a sex worker or females seeing a sex worker. Touching Base is a charitable organisation based in Sydney that's been active since October 2000, and it offers disability support workers training as well. It doesn't receive any government funding. I'm sure some of you might have seen the Love on the Spectrum TV show that was on ABC iView. It was really wonderful at talking about how to discuss sexuality from a teenager's perspective with autism spectrum disorder. And it highlighted a few people who are therapists and discuss building good relationships and discussing sex topics with teenagers. One of those people is Liz Thompson. She's an NDIS provider and she offers counselling and education and can be accessed through NDIS funding. And then I wanted to note the National Sexual Assault, Domestic and Family Violence Counselling Service. Just again, I don't want to harp on the negatives, but it is important that we acknowledge that some people here might be triggered by some of the topics we're talking about. Now we've got the next breakout session and then we might come back for a quick chat if everyone's okay with that.
Sounds great. So topic, as you can see up on the slide, as a result of tonight's presentation, what do you plan to do next? Again, that's going to be there in the chat as a bit of a reminder. Different group this time, so potentially you'll find yourself with different members of the community for this quick conversation. Again, we'll have some Q&A when we come back, so if there were any other questions you had about the topic, please send those through in a private message to myself. Otherwise, have a quick conversation and we'll see you back here in a moment. I've got a couple through. I'm conscious of your time though, and mindful that we're a little over, so we might just take one, and we might just ask this one here. So Liz, I'm worried about peer pressure. How do I teach my child about consent is the question. Love your thoughts on that.
So obviously a lot has changed in the laws in recent years. So consenting to one sexual act doesn't mean you consent to what then follows that sexual act. So it's really important that you know what's right and what's wrong. In terms of consent for people who might have capacity issues, so they may not understand the full situation or what they're getting themselves into, it's really important just to role play, but role play verbally, not in any sort of awkward role play way, but just to discuss about who you feel safe with, why do you feel less safe with this person, what are some strategies you could use when you're around that person, how would you say no, how would you get help. So peer pressure affects everyone, no matter what age they might be. And it's important that the person themselves has a strong sense of identity and self-worth and knows that what that person thinks of them isn't what their worth is. So if you've got a child that you can foster a strong sense of identity and an understanding that they can walk away from a situation and still be worthy, that's probably your best starting point. So really building up your child's personal sense of worth. Consent and capacity are quite well fleshed out in various resources online. So Council for Intellectual Disability New South Wales, the New South Wales NCAT Guardianship Tribunal, they have some really nice documents on what consent and capacity refer to. But essentially you want your person to be understanding of what words to use, how to back out of situations, and how to say yes to pleasurable things as well without maybe putting the other person in an awkward position. I feel like that's a very circuitous way of answering that question. I apologise.
Thank you so much, Liz. And thank you everyone for joining us this evening. I'm sorry we've gone a little bit over time, but I hope everyone got something out of that.